Okay, so the Bayanihan webinar series is held in cooperation with the Philippine College of Occupational Medicine, Perpetual Health Medical Center Binian, San Pedro College, San Pedro Pharmacy Department, and Clinical Pharmacy Support Group in the Philippines, Broken Shore College Pharmacy Department, Global Health Pharmacy in Asia, Tagum Doctors College, Catanduanes Doctors Hospital, Center for Pharmacy Practice, Research and Policy in Asia, St. Alexis College, Holy Child College of Information and Technology, Tagum Doctors Hospital. So mabuhay, it is now 10 a.m. and welcome to our Bayanihan webinar series where we talk about leveraging healthcare through virtual cooperation in the new normal. We are broadcasting live from our respective locations and I am Dr. Erica Davillo. I will be your moderator for today. The Bayanihan webinar series aims to fulfill the following objectives. To facilitate a smooth and orderly flow of the discussion, we have some reminders for our webinar house rules. So please adhere to the house rules to keep your account on the platform. The moderator, speaker, and reactor will be asked to turn their videos and microphones on. Audience are requested to keep their microphones on mute to minimize background noise and allow participants to focus on the talk. You may type your questions using the chat feature of the platform. The moderator will read these out and there will be an allotted time for answering these questions after the talk. The webinar will be simultaneously broadcasted on the Association of Medical Doctors of Asia and AMDA Philippines Facebook page. Impact of this global health crisis. We hope you enjoy the learning experience and realizations from this 5-part webinar series, and we look forward to carry on the spirit of camaraderie and mutual cooperation. May God bless our nation and may His face shine upon us. So for today's webinar, we will focus on the conduct of telemedicine amidst the current pandemic. Dr. Eugene Macalinga, our speaker for today, is a diplomate of Philippine College of Occupational Medicine and a lecturer at the National University of Singapore in Yong Lu Lin School of Medicine. After finishing his Doctor of Medicine from the University of Santo Tomas in 2004, he worked at Perpetual Hospital, Manila. In 2007, he pursued his specialization in occupational medicine and worked in several companies as an industrial and occupational health physician. He started teaching in 2006 and has experience in the Philippines and Singapore. At the National University of Singapore, he is teaching anatomy, physiology, and pathophysiology, and a committee member of the National University Health System, Total Workplace Safety and Health. Dr. Eugene is a telemedicine and home-based learning advocate and practitioner. He trains healthcare professionals in the best practices for teleconsulta in order to meet the current need for healthcare staff as we move into the new norms. Dr. Eugene completed telemedicine and clinical medicine from the Harvard School of Medicine and was given a certificate of achievement from the London School of Hygiene and Tropical Medicine for his completing his course on tackling the novel coronavirus. Currently, he is involved in the COVID-19 mobile swab unit of the National University Health System. On a lighter note, he is a volunteer teacher of FOS at the Bayanihan Center. He enjoys traveling, reading books, playing badminton, and is a confessed foodie. For our reactor, Dr. Jose Paulo Porcincula is the Chief Professional Services in the province of Hospital. A consultant at the Institute of Surgery, St. Luke's Medical Surgery, and the Assistant Training Officer of the Department of Surgery of Quezon City General Hospital. Without further ado, I now give the floor to Drs. Eugene and Dr. Paulo.
Magandang umaga. I'm not so sure if Dr. Paulo is around, but again, good morning to everyone. Thank you, Dr. Erica, for that very kind introduction, very generous. I also like to thank Dr. El Rey, Dr. Irwin, and Alfredo for organizing this Bayanihan web series. And I wish you all the best. Okay, so without further delay, I will be sharing to you my knowledge and expertise when it comes to telemedicine. Uh, as a beginning, I apologize if there's any IT or tech difficulty. We'll try to minimize the tech issue as much as possible. And I'll try to keep to my 30-minute limit so we will have more time for Q&A. I think I'll start sharing my slides. So again, good morning to everyone. So our topic for today is about teleconsulta. Some of you might be more familiar with the term teleconsult or telemedicine or telehealth. And this is the discussion point for today's webinar. Okay, these are my disclaimer. I'll just put it